All right, so we have all this great information. How do we take it and apply it to patients, and how do we document it in prompts? So let's pull up prompts and we will go through a sample patient. So we're an HPI. We just finished talking to them about their injury and we're about to move on to objective measures. Maybe we have a few extra minutes to do the nutrition screen. So if you missed that, I went to text templates, typed in nutrition, and I hit insert for that template. So here we go. I have a great knee patient here that we can practice with. So we just finished all of the chat about your knee. So before we move on to all of the tests and measures, I just have a few more questions that focuses more on your general health. All my coworkers and I believe that your mental health, sleep, and nutrition can influence the way that you heal from this injury. So I think it's important that we take a little bit of a dive in. If we don't go crazy today, that's okay, but just to get a baseline on you for how your diet is. So how would you say like your day-to-day diet and nutrition is?
I think pretty standard, I guess. I tend to have, usually like 3 meals a day. Um, I guess breakfast, I usually, I tend to be pretty busy, so I'll grab like a bacon, egg, and cheese or something like that when I pick up a coffee in the morning. Um, Lunch, I guess, kind of depends on if I have leftovers from the night before. Sometimes I bring that for work, or if there's food at the office or somewhere around the corner, maybe grab something. And then, just dinner is kind of more of the same. It's kind of what's convenient, I guess. I sometimes get pizza. Pretty frequently I grab some slices. There's a pizza place right around the corner from my house, so I tend to pop in there.
Awesome. Do you like fruits and vegetables?
Well, my boy Joe Rogan is always promoting his AG1, so I just ordered that. I guess that's supposed to replace like all of my fruit and vegetable needs, so that's cool, right?
We could definitely talk a little bit more about that. I think it's great that you're looking into nutrition.
Supplements,
Obviously. Yeah, supplements. Yep. So maybe we could talk about nutrition down the road. Would that be something you're interested in?
I guess so. I'll have to cross-reference it with my Instagram feed, but
Okay.
we'll
Yeah.
see.
Okay. I have some great Instagram resources I can also give you that are evidence-based and can help you with your diet. Is there anything in particular you'd like to learn about food choices? All right, open
I'm
book.
not sure.
Open book. That's great. That's great. We can do a lot of learning together. That's great. So I think, based on what you just said, we have some things that we can change in your diet, maybe add some things in and supplement what you already have, maybe find some swaps to get more nutritional value out of what you're eating. But I'm glad that you're open to it. That's awesome. So interventions provided. Thank you, patient. You did a great job. So patient education, the role of nutrition for health and wellness. I have my document on me that I'll give to my patient about nutrition tips to live fully so that he can continue his evidence-based learning before we get into it at his first follow-up. And we briefly went over some tips and goals. Some patient-directed goals to improve nutrition. I'll be honest with you, I didn't have time in my eval today, but that's definitely something you can write in. For example, it sounds like maybe increase to 1 to 2 servings of fruits and vegetables per day could be one, but I'd have to talk with my patient and make sure it's something that they're on board with as well. And as of right now, it doesn't sound like we need to refer for anything. There was no medical history, no medications, nothing where I think that medical nutrition therapy is required, but we'll see if things go down that road and my patient wants that. So like I said, in the referral criteria, none of those things apply to my patient right now. But maybe as he gets more excited about nutrition, he might want a referral to a dietitian and maybe away from all of the Instagram stuff. That'd be great, huh? So, and then going into how we bill for that. If we go to treat and flow and then add treatment, we've got our treatment templates. Select all. And if we go down to Highbar Health Patient Education Instructions and educate on the, instruct on the effects of behavior modifications to address sleep, nutrition, behavioral, or physical health. If we had gone a little deeper, we gave the nutrition handout. Maybe we talked about the fruits and veggies. Maybe we talked about maybe mixing in some other things for breakfast and not consistently having the bacon, egg, and cheese breakfast sandwich. Maybe we can put that in here and write what we counseled on. All right, and then we check it and we move on with our evaluation.